I'm Dr. Harmony. I'm going to show you today how to reconstitute your peptides and how to do your first injection. It's really easy, so let's get started. First of all, you want to make sure that everything that you ordered is included in the package. So check your peptides and make sure that each one that you expected to be there is indeed there. Secondly, we'll go ahead and unpack the contents of the package. You should have a large syringe with a blue needle cap. You should also have a bottle of bacteriostatic water. These are the tools you'll use to reconstitute your peptide. And then you should have your peptide, whichever one you ordered. Again, make sure that it's the correct one. You will also have a package of injection syringes. They have orange caps. You'll also have instruction cards. You'll refer to this card to discover how many milliliters of the water you'll be putting into the peptide vial. So once you've verified that all your supplies are here, the next thing you want to do is wash your hands really well. We want to make sure that we don't contaminate any of our supplies. Go ahead and pop the lids off of your peptide vial and off of the bacteriostatic water. Those lids don't go back on. There is a rubber stopper in the top, and that is what you'll insert the needle through in order to draw the peptide. So next you're going to take your blue topped syringe and you're going to open it whichever way you can. One of the most important steps here is to make sure that that needle is actually seated down properly, otherwise you might lose some water in the drawing procedure. You're going to uncap that needle and then you're going to go ahead and draw back to however many milliliters. Most of them need 5 milliliters, so I'll demonstrate with 5. I'm going to draw back to the 3. There's just air in this syringe now. And the reason for that is because it helps to depressurize the vial so that it's much easier to draw the water out. So next I'm going to hold my vial upside down, use my hand to stabilize, and then just go ahead and insert that needle through the middle of the rubber stopper cap. And then I'm going to push that air into the water vial. Again, that just makes it nice and easy to pull the water out. And I'm just going to draw that plunger so that the fluid is filled to the 3. That's 3 milliliters. Next, I'm going to go ahead and insert that water. So inserting the needle into the peptide vial and at a slight angle so that the needle is pointing towards the side of the vial. I'm going to go ahead and plunge that water into the peptide vial. And then I'm going to leave that needle inserted and I'm going to release my thumb. And this will release any pressure that's inside the peptide vial. This is important for making sure that you don't have any mistakes when drawing multiple peptides. So go ahead and watch the plunger. You'll see there's some air pressure in that vial that we don't want to have in there, because if there's air pressure in the vial when we insert a syringe, it will draw your medication up from the syringe into the vial, and you don't want to lose your various medications into different vials. We're going to repeat that process and draw 2 more milliliters of the bacteriostatic water. If you get any drips or drops, it's no big deal. And again, so I'm drawing the plunger to the 2, inserting that into the peptide vial. And I'm going to once again make sure that there isn't any pressure buildup, and there is, so just letting that release. And once the plunger stops moving, I'm going to go ahead and remove that needle and set this one aside. So now that your bacteriostatic water is in your peptide vial, you just want to make sure that all the powder is mixed in. Typically it just dissolves, but you might need to give it a little shake or swirl. Certain peptides like to get stuck at the bottom, and in that case you should shake it vigorously to make sure that it's all mixed in. And now we're ready to inject. Take your peptide vial and your orange cap syringe. Again, make sure your hands are washed. It's also a good idea every time you handle your vial to clean the lid with a little bit of alcohol. That way it prevents any contamination. Then we're going to go ahead and uncap the needle and the plunger. And we're going to go ahead and take a look at the syringe. There's a 10, 20, 30, 40, all the way up to 100 units. For this particular peptide, I'm going to inject 20 units for my dose. So in order to draw up the peptide, we're just going to take the needle and insert right in the middle of that rubber stopper and draw back, making sure that the fluid is coming into the syringe. Draw your plunger back to, in this case, the 20 units, which is 0.2 milliliters. And now I'm ready to inject this peptide. For subcutaneous injection sites, the best places to go are about an inch or two out from the belly button, the love handle, and potentially the upper gluteal region. So what we're going to do is go ahead and find a good area. You want to go ahead and pinch that area between your two fingers. The first thing you want to do is actually clean your injection site. So I'm going to pinch and inject. Again, 90 degrees to the skin, just a little dart-like motion. The faster it goes in, the less it hurts. And then you go ahead and plunge the injection into the skin. Pull the needle out and you're all done. You'll want to dispose your needle in a sharps collector. You can obtain one of those from any pharmacy.